Hey, Diva family. Welcome to episode 31 of Psychedelic Divas. Today, we're going to explore the critical role of nurses who work with patients utilizing therapeutic psychedelic medicines. I first heard about today's guest, Wendy Marussich, 2 years ago when I was at a private psychedelic party and I was chatting with a decades-long friend who was an OG psychonaut. He was excitedly telling me about his new partner, who was a nurse who had co-created an organization to support psychedelic nurses, which I thought was super cool. And I made a mental note that I'd like to have her on the podcast. Fast forward to last fall, I'm at the after party for the New Mexico psychedelic conference called the Enchanted State, which I've previously mentioned on the podcast, and I strike up a conversation with the woman next to me. When I asked her what her role was in this world, she told me she had created an organization to support psychedelic nurses. And my memory synapses clicked. And I said, wait, I know who you are.
Right.
Since then, I have seen Wendy at multiple psychedelic gatherings in the Bay Area, and we are happily cementing our new friendship. Let me read Wendy's bio so you have a fuller idea of what she has accomplished and her important work in the world. Wendy started her career as an evolutionary ecologist, completing a bachelor's, PhD, and postdoctoral fellowship in biology. She then became disillusioned with academia and decided to become a nurse to seek more meaning and geographic flexibility in her life. She began working as an oncology nurse and immediately fell in love with oncology patients and oncology nursing. After reading about the groundbreaking psychedelic research trials with cancer patients at UCLA, NYC, and Johns Hopkins to treat depression, anxiety, and end-of-life distress, she trained in psychedelic-assisted therapy and research through the California Institute for Integral Studies certificate program. Along with 3 classmates from that program, she then co-founded OPENurses.org. She also completed a 2-year Haikomi therapist training in somatic mindfulness psychotherapy, and she trained in ketamine-assisted therapy through the Psychedelic Research and Training Institute in Colorado. To help further address the mental health needs of her cancer patients, she decided to return to school, yet again, as she says, to become a psychiatric mental health nurse practitioner at UCSF. She then completed a 1-year advanced practice provider fellowship in psycho-oncology at Memorial Sloan Kettering Cancer Center in New York City. She then returned to San Francisco to join Mindful Health Solutions as a psychiatric mental health nurse practitioner. Welcome to Psychedelic Divas, Wendy. I am so excited to have you here.
Thank you so much for having me. Yeah.
So I want to start with your own psychedelic journey. Where did that begin and how did it shape you?
I'm quite sure where it began. I guess I had kind of always been known about them and sort of been adjacent to them for a long time. Did some explorations in my youth, but then...
As one does.
As one does, right. So I had started out as a biologist. Right? I was always fascinated. I studied plants and insects and always curious about psychology. I used to take psychology classes for fun in college. I was told I had to major in science and psychology didn't count, according to my family. So I actually ended up with too many science credits. I had to take a bunch of like art and music in my senior year of college because I had taken too much psychology. But it wasn't until years later I gave myself permission to kind of work in a profession where I could use my heart and my brain together, right? So I became a nurse, right? And then was working with cancer patients and finding that we don't actually, in a hospital setting, really focus on their mental health, right? So along that same time, I started reading about all the research studies with psychedelics, right? So that was kind of when things came full circle for me and started getting involved in that way. I was donating to MAPS for years, just small amounts, but then was like, wait, why can't I actually study what I'm interested in? So that's sort of how it began. Yeah. That was about 15 years ago.
Well, so your nickname is Dr. Nurse because you do have that PhD in biology
I
and then,
do,
of course,
yeah.
Nursing.
That was kind of an insult, actually. When people were trying, you don't fit in our box. Right? Wait, you're a doctor, you're a biologist, right? You're this. And now they're like, wait, you're going to become a nurse? What are we going to call you? A doctor nurse? So after about the 5th or 6th time someone said that to me independently, I was like, I guess that's my name.
I think it's an excellent nickname.
Yeah.
I think we all need to claim, all of our roles right up there up front, right?
Right. Yeah.
So there you are. You're switching careers. Like you're making this decision to go back into or to go into nursing.
hmm
And why oncology?
That was just, I don't know, the universe intervening. I thought maybe I wanted to go into work in the ICU because I wasn't afraid of math. Apparently, a lot of people in nursing school, it's like a prerequisite, you need to be afraid of math. And I was not afraid of math and calculating,
Wait,
drugs
I
and
thought
other
I
things.
thought you were going to say afraid of blood. Okay,
No, no, no. Like, so
math,
people,
of
it's
course,
like
right?
this. And I was like, okay, I can handle math and calculating things. So I thought I wanted the ICU. And then my first job, I got hired to the bone marrow transplant unit, which is so really acutely ill cancer patients have to be in the hospital. And I found I just fell in love with cancer patients. And you can use sort of your scientific background, have to use your brain, but also use your heart. And I found that I really enjoy having my patients being awake. And in the ICU, your patients are a lot of the time they're on ventilators or other things that or sedated in some way. So I really found that I loved having patients who were awake. So then I just stayed with oncology. I just really, really fell in love. Yeah.
I'm just curious, what's it take to hold space for patients? Like they're in their just worst, most terrifying times of their
Mhm.
lives. What's that like? What does that take to hold
Yeah.
that space with them?
How to stay grounded in that? Yeah, it
Yeah.
was I took to it naturally. I did a lot of training of new nurses when I first became a nurse. I was living in Arizona at the time. And so when you get hired to as a brand new nurse, you get a lot of on the job training for a few months. And it didn't phase me as much. So we'd have patients it's like literally the worst day of their life, right? They just got told they have leukemia or their scan came back or that treatment didn't work. And you just walk into the room, chipper, like, hi, my name's Wendy. I'm going to be your nurse tonight. Like, how you doing? And how to balance all of that. And I guess when distilling it back down, because I'd have to try to explain this to people who couldn't stay grounded in that situation, it was like, I didn't cause this cancer. This is not my I didn't cause this, right? But I can walk into this situation and how can I make this better? How can I um make a difference? I really enjoyed the switch from academia to nursing was profound because in academia you might spend 2 years slaving away doing all these things. And then you publish a paper finally at the end of this, 2 years later, you publish a paper that, 10 people read. And you're like, look, I made a difference. And then when I switched to nursing, you could make a difference in real time. Um, I can bring you a glass of ice water. And the way that's handed to you or can change your world. How you could just make that difference in real time. I really, really enjoyed the tangibility of that. Yeah.
So I am curious about those. You say that you walk in and I'll be your nurse tonight. So it sounds like you did a lot of, overnight shifts.
Mhm.
Um, what's it like to relate to people in those hours when,
Yeah.
they're dealing with an oncology
Mhm.
diagnosis? I mean, it's obviously there's the glass of water, there's bedpans, there's details, there's
Mhm.
blood pressure, but what are the conversations like?
Oh, yeah. So I pretty quickly switched to night shift when I was given the option. So in most hospitals, 12 and a half hour shifts, 7 to 7:30. And I fell in love with the night shift because you actually get time sometimes with the patients to have these conversations. Because there's not all these other ancillary departments coming in to, the nutritionist came in, or now the whatever respiratory is here, or all these different visitors. So at night, a lot of times it's just the nurses and maybe a select subset of visitors who are in it for the long haul. There's also no administration or other things that are just sort of interrupting. So you can really kind of hold that space and be able to have those conversations. I would work my 3 shifts in a row. So by the second or third night, sometimes patients would really start to be able to open up and to it later on I started volunteering with the Zendo Project, which is where you're doing psychedelic support. And so many of the skills I learned
At
as a nurse,
festivals,
at
not
festivals,
not in a medical
not in a therapeutic at all.
situation.
This is pure support, but so many of the skills I learned as a nurse, right? How to make somebody feel safe, how to set the expectations. Okay, I'm going to be coming in here at midnight to check your vitals, and then 3 a.m, I have to tiptoe in and hang an antibiotic. You might see me. You don't have to wake up. You don't have to engage. You can set those kind of expectations for what's going to happen. So, because how do you calm somebody's nervous system so they feel safe, so they can actually sleep, right? Some of these patients will have to stay in the hospital for a month at a time. You can't just, I'll go home and sleep in a few days and it'll be fine. It's like, no, you need to learn how to rest here. So I really enjoyed being able to do that and make people feel safe. And I found that I really had a knack for it, or how to explain stuff in different ways. Everyone has different medical knowledge, has different sort of emotional savvy, different social, everything, cultural. How do you explain something to somebody that they can understand, right? That is not overwhelming with too much information either.
Can we talk a little deeper on that role of trust? It's critical. Are there nursing courses in trust? Are there medical courses in trust and patient trust? I'm going to guess not.
But yeah, how it comes about is something, it's kind of embodied in being a nurse, right? So for over 20 years, they put out the survey of the most trusted profession every year. Nurses top the list every single year, except for 2001, firefighters got that year, which we'll give that to them. September 11th, right? But nurses just top the list every single year because we have to be trustworthy, right? And how do we hold space? And we lead with caring. And it's an interesting question. Like, how is that taught? It's just kind of part of everything we learn. Yeah, when you think about like ethical violations and things, you almost never hear about that in nursing. And yet there are 5-6 million nurses, right, in this country. At any moment, nurses are interacting with patients who are in extremely vulnerable, extremely intimate ways, right? We are cleaning feces out of places it does not belong. Every second of every day, this is happening, and you almost never hear of any infractions, right? And how do you make somebody feel safe and comfortable while that's going on, right?
Yeah. So how do you do it?
I
want to sit with this because this is your nature. I'm feeling. My mom was in the hospital in 2019 for a month, and I was back east doing tag team hospital and physical therapy duty with her and my sister, and you could just tell the difference. Like, we got a good nurse today. Oh no, and I mean, I'm not talking about unethical.
Right.
I don't mean any of that, but
but yeah, just the personality or something.
The caring, the connection, the trust, the listening, the like in tune, and you apparently have it. When you're like, but it's so critical in a psychedelic experience to have that embodied sense of trust of the person who's next to you.
Yeah,
I just love for you to speak more about where that comes from. How do you think that you actually embody that?
And also, we could thinking about how is that taught, right?
Yeah.
Now there's all the, trauma-informed care is a big thing, a big buzzword, but also
so
an actual thing, right? Realizing.
Very important, but
yeah, how do you?
But that's heady in a way, right?
But
it's very,
There's also respecting, bodily autonomy, respecting, boundaries. But then at the same time, we also need sometimes to take care of a patient, right?
Yeah.
They don't want to be touched, but sometimes you have to be touched, depending on what's going on.
Right.
But yeah, I just, people talk about nursing being a calling, and I didn't really understand that until I became a nurse. And some people become nurses, I think, because they need a stable career, or they've heard it's a good career, and maybe they'll have a steady job and make money. But the people who stay in nursing or they don't make it through nursing school because then they're like, oh wait, this is way too much work, or way too, right, or I don't like blood, or I don't like people, or
Or math.
or math, right? Yes. Yeah. So I mean, the people who stay in nursing, it really is a calling, right? There are maybe simpler and easier ways to have a career, but there's something about the humanity, that level of just, it's like a primal, evolutionary, deep connection, that you can form. It is sacred work.
I think those are exactly the words. It's sacred work, and so is the psychedelic work.
Mm-hmm.
And I think I want to explore a little bit as we talk about, your work in this area, that juxtaposition of the medicalization model that we have to
Mm-hmm.
have in clinical trials, et cetera, and then compare that to the words that you just said. It's sacred. It's sacred work.
Mm-hmm.
I want to talk about that in
Mm-hmm.
conjunction with OPENurses. So you co-founded OPENurses. On the website, it says the Organization of Psychedelic and Entheogenic Nurses, OPENurses, represents nurses at all levels of training who work with patients utilizing therapeutic psychedelic medicines. We exist to establish best practices, clearly define appropriate care in psychedelic sessions, elucidate a code of ethics and conduct, advocate for the full inclusion of nurses in psychedelic therapy, provide continuing education related to psychedelic therapy, and provide a place for professional networking.
Mm-hmm.
So that's fabulous and
Mm-hmm.
great and awesome, but it also that description fits a little bit in that kind of more medicalization
Mm-hmm.
time. So,
Right.
but I know that we've got the sacred
Mm-hmm.
work wrapped into that. So, can you speak a little bit to how do open nurses work?
Mm-hmm.
Within those two frameworks, I guess.
Right. So yeah. So I think across everywhere nurses exist, we always have nurses serve as bridges and translators, and we connect between the medical world to the nursing world. The nursing training and medical training have different priorities, right? And different ways you can describe it, but I envision as nursing is way more holistic, right? We're looking at the entire person and the larger system that they fit into. We're not just looking at your tumor or at your kidneys or at your whatever's, the we bridge the kind of the micro and the macro with open nurses. So everyone, nurses are, we are medical professionals, right? And we are legally bound by a whole bunch of other laws and regulations, which pros and cons to that. But how do we use this training, this philosophy? We have millions of people who are highly trained to be able to work with patients. And I think it's much easier to add a little psychedelic training on top of this vast body of how to do this sort of sacred work already than to go the other way around, right? So to take some medical professionals or therapists even, and then teach them how to be with bodies and humans. And we can already tell the difference between are you having a panic attack or are you having cardiac arrest? A
That's
nurse
helpful.
can do that, right? And um nurses are used to being in all kinds of situations. And how do you stay calm in a crisis? How do you handle that? How do you keep the patient calm, right? A patient that starts bleeding out on you, and you're providing reassuring guidance while also putting pressure on that wound and calling for help and doing all the things, but you're staying with the patient. So those sorts of skills translate so well into the psychedelic space with working with whatever's coming up. And then, so OPENurses started. It was I was part of the second cohort of the psychedelic certificate at CIS here in San Francisco, which was the very first academic program in psychedelics, above ground academic program. Put it on top of your CV, right? So the program was only open to therapists, medical professionals, nursing professionals, and clergy. And so when we got in that program, I think there were 6 nurses in the program, and about 40 of us. And we were just so happy initially to just be included. Like, wow, I can't believe nurses are even on the list of this, right? Because you hear it's, oh, must be all, therapists and psychiatrists or something. What do you just have at the time, this is a while ago, the mindset of like, oh, we're just nurses. And then it was, as things shifted and as you sort of looked at what the skill set that can be involved, it was like, yeah, we're nurses. Like, nurses have so much to bring and to contribute. And how do we bring this grounded presence? How do we bring our stamina? How do we bring our ability to be and not do, right? So sometimes with other professions that you're bringing into the psychedelic space, you kind of have to teach them how to do less, right? There is always intervening, interrupting, doing some kind of intervention or talking, right? And that's not always what's needed in a situation, right? Just cautiously observe and hold space. So, nurses work 8, 12 hours at a stretch, right? Try to get a doctor or a therapist to stay in a room for more than an hour or maybe 2 or sometimes 15 minutes, right? Like, we all have our different attention spans. And so OPENurses, we found there was kind of a need. How do we represent nurses in this space? These highly trained, empathic people. How do we get them a safe space to connect and to network and to realize how much power and knowledge we have? And how do we also bring our very high ethical standards into this space too? So when we founded, it was kind of a, find the others kind of thing, but then also to educate people on what does a nurse do? What can a nurse bring? Why would you want a nurse in this situation, right? And so far, we've found we haven't had any pushback. Anytime we've spoken up about something like, oh, I think there's an oversight, we realized you didn't have any nurses involved in your conference or on your list of qualified professionals. And every time we've written a letter or had a campaign, spoke up, they said, oh, thank you, yes. There'd been like, no, we don't want nurses. They were like, oh my gosh, how many are you? Can we have more? Like, so it's fascinating. And yeah, it keeps us going.
Well, I want to circle back to something you said. So that training that you got, on the job training, where you are keeping the patient regulated while they're bleeding out, while you're holding pressure, while you're calling for help, all of those things. So what's the equivalent that you've experienced in any psychedelic sessions of a patient bleeding out? Obviously, without the blood.
Yeah, ideally. You never know.
Unless there was blood.
Right. I have been known for my festival bandaging skills, but they generally don't involve psychedelics. But yeah, so like as a volunteer, mentioned for Zendo, so people who don't know, the Zendo project helps provide psychedelic and psychological kind of peer support at festivals. So
it's the safe place you want to go.
Safe place,
you or your friends are freaking out.
Yeah, and you can have a safe place, or if you've finished, you already had your freak out. You don't have to be under the influence at the time you come to Zendo, but you need a safe place to kind of process whatever's going on. So there have been some pretty wild situations I've seen while volunteering there, and also at other festivals. I've helped out, or people just know me, and then people come running in the middle of the night, Dr. Nurse, someone's bleeding or having a mental breakdown. So yeah, so
what are those stories? What does that look like?
Kind of think some that would come up. So you're in a high dose psychedelic, you're maybe paranoid, right? You don't know where you are. I kind of liken it to like you're kind of like a feral animal. You're a scared cat that doesn't know where it is or what's happening, or suddenly is in a big city or whatever, freaking out. Sensory overload, doesn't understand what's happening. And how do you grasp a thread or throw a lifeline to that person that a little bit of safety can penetrate whatever feeling of overwhelm they're having. So there are ways to, drop little nuggets or to be such a calm, grounding presence. You're kind of thinking of, talk about a feral cat or something, a kitten, and how do you befriend it, right? You don't go towards it and grab it and pick it up, right? You just sit calmly nearby, maybe offer snacks and water, somewhere soft, somewhere cozy, like those sorts of things apply to humans in altered states. And so, so that I think nurses have had a little more experience sometimes with that because you had a patient, so many things are altered states, right? Birth, death process, suddenly being on pain meds, coming out of anesthesia, just pain itself is right? So you have a brain tumor, so you don't understand what's going on or how the world's working because you're, all sorts of reasons why you're cognitively impaired or altered or, right? So I think as nurses, we bring sort of that ability to the creativity to how do you think on your feet when you, this situation's happening and it's on you to figure it out, right? So bringing it, I don't know what you're wanting here, like bringing it back to psychedelics. It's just sort of a continuum, I think.
Well, I guess I'm looking for any good stories, but also any good nuggets, right? So you're like, well, there's ways to chat
right.
with
the feral cat, right? Offer your hand, don't grab it, right? You just
let it sniff you.
Let it sniff you, and and don't make any sudden moves. And the power of water, snacks, a blanket. So I'm also trained in Hakomi, which is a somatic mindfulness psychotherapy technique, and one of the most powerful principles of that is sort of there's this loving presence. So you're always operating from a place of loving presence. So you're trying to monitoring your own energy field and just putting out good energy towards whoever you're with, benevolent, neutral, something. But then there's also the nonviolence principle. So getting these macro and micro consents, right? So even just putting out your hand to a cat, right? You're getting a little, like, I'm not going to touch you, but here's my hand. If you want to approach it, you can approach it. Or here's it, I'll put this nearby. Or I'm going to inch the snack towards you. But you're using nonviolent principle. So I don't know if I have a good story for you. We've had a few patients, or I should say guests with Zendo who they're just so in a frightened state. They're just panicked and they know they're lashing out. Just go back to our cat analogy, right? They have claws perhaps, and they're not meaning to necessarily hurt you, but they're just so overwhelmed and scared. And now suddenly they're attacking people, not necessarily meaning to hurt you, but they have claws and it's happening. So similar things can happen with humans in these highly altered states. So we've had, people try to bite, people try to run, and you just kind of stay calm, keeping yourself safe too.
So at Burning Man, they come into Zendo and they try to run. Do you chase them?
No, I mean, people have free will, right? Yeah. And there are other resources. So something like Burning Man, right? There's rangers, there's other types of medical. So we're just the psychedelic support center, right? And if they don't want to come there, we're not holding them against their will. People are not being committed to this, right? And there are other groups of people or crisis intervention team who can follow people at a safe distance and make sure they're okay, or find, friends or things like that. But a lot of times, if you can show that you're safe and we don't mean harm, and calm and gentle, people will want to stay because they're cold, they're tired, they're hungry, they're tired of being so scared, right?
Yeah. Snacks.
Right? Yeah, snacks, cup of tea. Yeah. So I think what I loved to do when I would volunteer with Zendo is there's usually they change the name for different times, but generally it's the medical screener kind of thing for Zendo. So somebody comes to Zendo, different festivals, a different size tent, but a big tent. There's some greeters who take some basic info and figure out what's going on. But then there's just a medical volunteer who will assess the situation. And you can use my nursing skills to be like, is this a medical issue? Do they need to be at the medical tent? We're not providing medical care here. But we can pull out the story pretty quickly and figure out what's happening and whether this is safe or not, and then hand it off to a volunteer who will be the sitter. It's one of my favorite roles to do with Zendo because I can use my assessment skills to kind of figure out what's going on, and then also use my sort of teaching and educating skills to educate both the sitter and the guest who's coming in to tell, this is what's happening, and this person's gonna sit with you and do this, and people are like, okay, great, and then you get to go back and forth and check in on people, how they're doing, but not be sitting with one person for the whole night. I feel it uses my skills better to kind of float around, but exuding that safety. And when you can convince somebody that they're safe medically, so I think part of the power with nurses is I can look you in the eye and tell you you are not in medical crisis and actually know that that's true. And you'll believe me because it is true, and I'm not lying to you. Having somebody who doesn't really understand, blood pressures or heart rates or something, or they think you're okay, but they have no medical training. And maybe a therapist, they're really great at sitting with you. But if they're not sure if you're in medical danger and they're trying to reassure you, it's going to come from a different place. And you can see through that, especially in altered states, since their acuity is higher, like the mental abilities, the abilities to see through things. I remember there was in one of Stan Grof's books, he was saying, written in one of his older books, maybe it was LSD therapy, but he was writing about how he was just amazed at how people who were in the LSD therapy sessions, this is probably in the 60s or something, 70s, they had such insight, and they're asking about the therapist's lives, and they could tell that the therapist was unhappy or that something was, and he was just blown away that these are not trained psychiatrists, and they're asking me high level. They have this insight. When you're working with people in altered states, whether psychedelics or otherwise, is they can perceive things. So if you're not actually operating from a grounded place, that can be felt, and that will be in the energy field. If you have somebody who doesn't know if you're in a safe, say medically safe, is trying to reassure you, it's not going to land the same. Which goes back to the original example with the patient who's bleeding out, right? And the nurse is reassuring you, no, this is going to be okay, because 90% chance, I believe you probably have a 90% chance it'll be okay, which is pretty high, and we'll go with it. Versus somebody else who's just freaking out at the sight of blood, they're not going to be useful in that situation.
No.
But they'll be useful in many other situations. It's we all have our strengths, right? So that's part of what we're trying to, that a lot of the strengths that nurses have, we want to bring into this space. Yeah.
Hey, fellow explorers. Thoughtful planning and preparation is the foundation of any successful psychedelic journey. And if something does go wrong, knowing how to navigate that difficult space is essential. That's why I wrote my psychedelic safety guide, including what to do when things go wrong. It's filled with tips and tools for keeping you and your friends as safe as possible. You'll find it at our website, psychedelicdivas.com. Please, go get it, read it, and share it. The more we all know, the safer we can keep each other. Well, I want to drop back into sort of some psychedelic history. In this week's Microdose, which is a free newsletter from the UC Berkeley Center for the Science of Psychedelics, which I highly recommend, and I'm going to link to it in the show notes. So in the Microdose, they talk about early psychedelic therapy this week, and I'm quoting from the Microdose. In 1954, in England, the psychiatrist Ronald Sanderson was the first to propose a method of psychedelic-assisted psychotherapy to try to encourage and to support the patients to develop what we now call set and setting, the technique to reassure the patients. In this new therapy, the person who was responsible for reassurance, for instance, putting the hand on the forehead of the patient or taking their hand, it wasn't the doctors who had this responsibility. It was a nurse. At that time, physical touch was completely taboo between doctors and patients. And on top of that, the nurses were women. They were seen as naturally suited to this role. doctors, who were mostly men, had to have a very distant attitude towards the patients. All right, we've obviously
Yeah.
come a long way in terms of medicine and standards of
Right.
care since then, but the psychedelic world is still working out the best, safest
Mhm.
ways to use touch in a psychedelic session.
Right.
And, unfortunately, there have been massive breaches of trust in this area in the
Right.
past.
Right.
So, how do you hold the practice of touch and consent within your practice, and what do you teach about this on Open Nurses?
So yeah, ethical touch is just taught from day one in nursing school, right? We're going to be touching patients. It's not a question of whether we will or not, or how to, or right, or after your third therapy session, you could hug or touch, shake someone's hand, or people have these different rules, these different, how do we do this? So I think that's one of the huge strengths is that nurses are comfortable with touch, right? We touch patients all the time, even just to touch to check a blood pressure or, something, yeah, like that. It was just very comfortable. Now that I work in psychiatry, I touch patients a lot less because there's just some of these basic mechanics, or I work with ketamine and, a technician will generally check the blood pressure. So I'm not even just touching patient's arm, let alone in a therapeutic way. But no, nurses have been around in psychedelic space from the beginning, right? As in, I haven't seen this article yet, but there was also, I don't know if you've heard of Kay Parley. She was one of the, she was an LSD nurse back in, she had an article on the American Journal of Nursing in 1964 called Supporting the Nurse, or Supporting the Patient on LSD Day. And so she was working in Saskatchewan, Canada, doing as a support. So they would dose these patients on LSD, and then the nurse would sit with them in the basement of the psych hospital all day.
And what was her name? I don't know her.
Kay Parley, Kay Parley, Parley. So she worked with Humphrey Osmond in the
Okay.
50s and 60s. Yeah.
Yep. So we know
So
we know his name,
yeah,
of course, but not hers.
yeah, of course, but that's changing. She has a great book called Inside the Mental, which was because she was actually a patient there growing up, and then so Andrew Penn, also from Open Nurses, so he went and interviewed her shortly before she died. She died at, I think, 102. When she was 101, he went, or 100, he went up and visited her. So anyway, let's see. We got a little
So
off
she's
track.
talking about she was talking about sitting with the
Sitting
patient
with
in the
the
basement.
patient,
Yep.
right? Which goes back to your microdose thing as well, so that nurses are able to touch people and provide reassurance and do so ethically and I think it's a non-awkward touch is what, yeah, the majority of nurses have, just because
Oh, I
of
like that. So the non-awkward touch. Is that
non-awkward touch.
actually a phrase? I mean, is
I
that
mean, it is now, we're making broad generalizations here, but on the whole, I think nurses are skilled in this sort of non-awkward touch, versus, maybe a psychiatrist or therapist who their entire career they've been taught to not touch a patient, they've learned how to turn off that instinct to put their hand on somebody's shoulder because, oh, this is wrong according to our professional standards, right? And so it can be a big adjustment when some of these other folks want to work in psychedelics, which there's definitely a role for some therapeutic touch, I think, and reassurance, or even just a handhold, or so having to learn how to use that instinct to touch because they've turned it off literally sometimes for decades. So you cannot, right, reassure somebody. So nurses don't necessarily have that. They have other things they have to wrestle with as transitioning from, standard nursing into maybe psychedelic nursing. But the
well,
touch
just
component
in
is not.
that, so it is a different level of care. And do you train the nurses to have, like, again, we're preparing, just like you said, I'm going to be back in at 3 to check your blood pressure. Like, you're
Mhm.
preparing the patient for what the experience is going to be throughout the night
Mhm.
as you tend to them. Do you train the open nurses that they should also have a conversation? Like, are you, I'm going to be right here. I'm available for this kind of touch. I won't.
Mhm.
I'll let you ask for it, or, like, is there a protocol that you, prior to the session starts,
Right.
that nurses are, is there a conversation around touch?
I think there should be. So we don't directly train nurses. For open nurses, we're just kind of a professional organization, right? So we serve as watchdogs. We do interviews, kind of more generalized education. We're not, we don't have our own workforce. I'm not training nurses for a clinic or something, but it is, I think, brought, nurses have that naturally, but as these containers are being developed for different substances, for different research trials, for different as things are being legalized, these are all kind of part of the setting discussions that should be happening, I think, across all professions. I do think nurses can bring a unique perspective to it, but it's not exclusive to nursing, or not directly responsible for those sorts of things.
Well, okay, not to put you on the spot, but what
Mhm.
do you think a good conversation would sound like or look like before in preparation for the psychedelic session? What do you think should be laid out in terms of touch?
So I work above ground. I'm a licensed provider, very committed to working above ground in legal contexts. So
So
I work
why?
with
But you work
esketamine.
with
Yeah.
ketamine,
Mhm.
okay?
I work
So
with esketamine,
you
which
know,
is the nasal spray, Johnson's nasal spray, covered by insurance, to choose to work with because of accessibility. I believe that these medicines should be able to get out there to people. Um, and so I let them know what's going to be happening. So by law, by the REMS protocol based on this medication, when you prescribe it, the patient has to, so we tell them the basic ground rules. So they have to be in the clinic for a minimum of 2 hours after they get the nasal spray. The first half hour of that will be spent with me. And then there are technicians available to check in on them. By the law, we have to check their blood pressure and heart rate like before it starts, at about 40 minutes in, which is generally when they're like peaking, and then at the conclusion of 2 hours. So they know they will be touched for blood pressure. We offer blankets or weighted blankets for them to, and there's a call button, but majority of the time they're alone in a room, which has its own, it's not my choice, but they do know they will be touched for blood pressure, and we talk about that. If do also inform them if something does come up, they can hit the call button. One of the technicians can come and sit with them, perhaps hold their hand, or they can call me if something escalates. But in this context, we generally don't. Touch isn't really a thing. I have trained with other medicines, or I have taken part in other ketamine sessions where there's sort of higher dose ketamine or intramuscular, sublingual. I have trained in the Netherlands with psilocybin. Those sorts of things, touch may be more part of it. If you're on some of these higher doses, you're not really in a verbal state, right? You're not able to, let's chat about this. It's like, you're grasping at the threads of reality, and you want a grounding force. And maybe, so when I have worked in those spaces, it's been discussed beforehand, or when I've been in trainings, it's discussed beforehand, and to role play this. It's also done in some of the research studies, like with psilocybin. Because it's not something to decide in the moment what you're comfortable with. So when I've taught some students before, have them lay down and put on the eye mask and imagine, what does this feel like? Okay, what feels safe? Okay, they're like, oh, I'm fine with touch. I'm like, no, we're going to break this down. Okay, how's your hand? Okay, we can touch your hand. How about if I touch your forearm? How does that feel? And actually feel it, or your shoulder. And then be like, okay. And then they're like, okay, yeah, hand is fine and forearm, but I don't want shoulder. And they're just trying these things on before any medications are involved, right? This is part of building your container, right? Or they're like, no, I don't want any, I've had students be like, they don't want any touch at all. Or if I want to be touched, I will reach my hand out. So we can figure out a cue beforehand. If they stick their hand out, then, you can touch it. But I've seen in, some trainings where somebody just instinctively reaches out and touches somebody, and that can totally trigger something jarring, snap you out of whatever you were in, can be violating, right? So these are all part of larger conversations within the whole, I think, psychedelic space.
I think they're critical conversations, which is why I wanted to be
Yeah,
actually
you
as
want to.
specific around them as possible.
And I would encourage, right, anyone doing any of these things, with a guide or a provider to really bring this up, and if the person who is serving this medicine is not bringing this up, bring it up. These are things that, should be discussed, should be tested out beforehand.
Yeah, and then the boundary is set. So if they say, "I don't
Mhm.
want touch," what would you
Right.
say to someone
Mhm.
when they're high and they're asking for it?
Right. I've done it before. I've done it in a training as well, where like we can say, remember we talked about that you didn't want touch. And so some of my somatic training, you can do imaginal touch. Okay. Can, imagine my hand on your shoulder. Imagine me holding your hand. Um, and the power of embodiment, that can be incredibly profound. Played around with that with Hakomi, which is the somatic psychotherapy too. But you can say, we talked about how you don't want to be held, we're going to honor this boundary. And maybe in another session, we can do that. That's where I think some of these infractions have happened, right, in the psychedelic space, in research trials and otherwise, when then in the moment, suddenly, the client feels disinhibited or wants some things. And if the, provider goes along with it, it's not what we talked about, right? And then there can be all kinds of feelings of shame and hurt and fear and things later. So it's part of the whole trustworthiness thing. But yeah, I would encourage people to experiment with imaginal touch. Just imagine it.
I like that. That's
Yeah.
a new one for me. I'll put that into the
Mm-hmm.
toolkit to share with people. I think that's important.
Mm-hmm.
So, for nurses who are not currently involved in psychedelic work but are interested, so what kinds of additional education and preparation do you think nurses need to safely and ethically participate in psychedelic assisted care?
Yeah. So right right now, the legal avenues for nurses to engage in this is generally in the ketamine space.
Hmm.
There are a lot of
Or clinical trials?
clinical trials, right? But there are also, on our there's limited trials. There are some for sure. So encourage people to do, to read, to do their own work, right? If you can't regulate yourself in a situation, stepping into a situation to try to be a regulator when you can't regulate is dangerous, can be. So I encourage people to, you can participate in ketamine trainings.
Hmm.
I really enjoy the trainings with Prati, Psychedelic Research and Training Institute in Colorado. Polaris is another one that has some great trainings. They more and more keep popping up, but where you can have some kind of an experiential training to understand what it might feel like. I think it's true of all nurses. And I remember in nursing school volunteering when we were like learning how to transfer people in beds and like scoot them from a bed to another bed and drag them in a sheet, or use one of these lifts to like lift somebody in and out of it, and volunteering, and then suddenly feeling how overwhelming it feels to suddenly have, you're laying in a bed and people are looking down at you and they just picked you up and you're in the air. And how does that feel? And I think everyone should experience that if you're going to be on the other end of doing that, right? What does it feel like to be put in an ambulance? And then you might put people in there slightly differently, having tried it when you're not injured, just to, right? What does that feel like? So yeah, so I encourage, nurses to do their own work, to do their own therapy, participate in, or there's also holotropic breath work, right? Which is you don't need to use medications at all to get to some of these states.
Or you could go to where
Yeah,
it's
you
legal
could go to, right, where
in
it's legal. We encourage people, yeah, you can go to, right, Peru, Costa Rica, Jamaica, right,
Yep,
Africa. There's all these different,
Mexico,
Mexico, right?
even
Yeah, and then
Canada. Are-
Canada, yeah, yeah, and now we have 3 states, or I think I heard New Jersey just passed the
New
psychedelic
Jersey's
law.
on its
Yeah,
way. Yep.
yeah, yeah. But we have Oregon and Colorado, as well as New Mexico, where we met. They were celebrating their new change in their laws. So there
And
are
they're
places,
about a
yeah,
year out before they'll be
mhm,
seeing patients for that.
seeing patients there. Yeah.
And just a shout out to an earlier episode. I don't remember what number it is, but it's Andrea Romero. I just had her on. She was one of the speakers at the conference where we met. She's the state representative for New Mexico for she represents Santa Fe, and she was one of the representatives who got that bill across the line. And it's funny because she has zero psychedelic or altered states experience. And so I was like, well, okay, so you're the first person I've had on the podcast who's
Right.
never done any drugs.
Right.
But she promised to come back after she's gone through
Wow, yeah.
the legal above board once they're seeing clients. So she's going to sign up.
Great. I mean, they're incredible tools. And I mean, a lot of people in psychiatry and other fields don't have any personal experience with these psychedelics, but the data is profound, and these are incredible tools, and they're not one size fits all, and they're not necessarily appropriate for everyone.
But I very
are
strongly
incredibly
believe,
helpful.
yeah.
You know, some of these politicians and other people who have not tried these things, but they can see how it has helped people. You know, like MDMA for PTSD, right? Or psilocybin for end-of-life anxiety.
Right. Or now Ibogaine, the $50 million that the politicians have gotten across for research into Ibogaine in Texas, of all places. That's Rick Perry, who is one of the leading voices in that happening. So, yeah, but I feel really strongly that practitioners sitting with, on any level, sitting with psychedelic patients should have some level of altered, not just holotropic breath, or some level of altered state experience. I don't see how you can really. It's what you talked about earlier with Stan Groff. Okay, like the client has a heightened perception, and they know when you don't know where they are, or what's happening, or when they've gone beyond the depth that you're comfortable with. They see it, they feel it, right? You have to be able to hold that space with them and say, no, I've been there. It's okay. You're. I think that's important.
And to be able to say it with conviction, because you
Right.
do know it's okay.
Yeah, because it's not just, I took a training and had one ketamine experience. It's
Right,
like, no,
and they said it'll be fine. It's like, oh, it's fine.
Yeah.
Yeah. So I will put a little shout out for, we have, as Open Nurses, we do a monthly interview series. It's on YouTube. You can go to our YouTube channel, but we're interviewing nurses and nurse practitioners and some allies as well, non-nurses, who work in the psychedelic space from all different angles, all different ways. So that's another way for nurses who want to get involved in this, or they're like, I didn't know nurses could do this. So we have 4 years worth of interviews showing nurses who have carved out spaces to be able to do this, and in research trials, in other places, in clinics. And yeah, it's another great way for people who are interested to see the possibilities, because it's not a defined thing, right? You want to be like, okay, I want to be right, I want to be a dermatologist, or I want to be a surgeon. There's a
that's defined.
Jump through all these hoops. They maybe take a really long time and be really, really hard. But there's an actual thing and an actual credential, and that is understood that this is right what you are. So in psychedelics, it's still not defined. We're working on it. But yeah.
Does Open Nurses have any ways that they support practitioners in avoiding burnout while they're doing such deeply relational work? I mean, especially in the field of oncology, if you're working with end-of-life patients.
Right. So we do a monthly meetup on Zoom. And so anyone can drop in, and it's a way to connect with other people and find the power of community. And we're also having some local chapters that are forming, deputizing people around the country or the world potentially, who want to have sort of local chapters where you can help provide the source, the support. We also have a Facebook group where people can post and share and ask questions.
Awesome. And all of those will be available in the show notes for those of you who are driving or walking the dog and listening. Wendy, what practices keep you personally grounded and resourced and spiritually aligned in this work?
Yeah, it's the sort of the ability to zoom out or to not take personal responsibility for a lot of the things I hear. We know that I learned that initially as a nurse, you hear people's stories of cancer and all these other things, and it's like it needs to be heard. They need to share this with somebody. And how do I take your story, hear your story, but then have it not stick to me? How do you put it down?
Yeah.
And so I used to be dancing to electronic music, doing yoga, spending time outside, just moving your body to have this stuff not stick.
Yeah.
And so then it became harder now that I work in psychiatry, because I hear all the details that people only come to me when they're struggling. And then on top of that, since COVID and other things have shifted a little bit just in the world. But yeah, I have to have more deliberate practices. So dance, movement, going for a walk, taking my cat for a walk. My cat walks on a leash. Take my cat for a walk. That's a good way to reset, which adds the added bonus of resetting everyone you encounter on your walk too. People are like, "What's a cat? What's happening?" Yeah. Or going to festivals and events, being around other people, remembering there's good in the world.
Yeah. Community.
Mm-hmm.
Yeah.
Yeah. We're not the only ones who are trying to make a difference. Yeah.
All right. So, last question. What's your deepest hope for the future of nursing within the psychedelic resurgence that's happening right now? And what legacy do you want OPENurses to leave?
See, I want anyone who's looking to, open a clinic or start working in this space to think about safety. I think having a nurse in the room automatically increases the safety. I think just.
Yep.
So I want people to think about in their clinic designs, how do we incorporate nurses? How do we get the buy-in of nurses to just automatically be like, oh yeah, you're hiring nurses, right? Or especially if you want people to be sitters, you don't necessarily, especially depending on the psychedelic, you don't necessarily need a therapist in the room or to be doing high complex processing in the moment of the right, where so much of the psychedelic work is keeping somebody's vessel safe while they're journeying. And I think nurses are perfect for that. And I think if our legacy could be that people think of nurses immediately when they think about safety, ethics, and psychedelics. Yeah.
You just remind me of the story of the first time. So I went to the Palenque conferences that I've talked about this on the podcast previously. These were the ones they were put on by Terrence McKenna and Rob Montgomery and Ken Symington, and they were down in Palenque, Mexico. They were quite the just full-blown psychedelic experiences, conference-wise. And the first time I went, I became friends with a nurse, and her specialty was introducing people to I am ketamine for the first time. And I was still, this was 1999, I think, and I'm still very much, I'm a good girl on all levels. I'm at this bad girl conference, but I'm a good girl in my heart. And I'm like, oh, needles? Am I going to do that? And I did. Spoiler alert, yes, of course. But I did it because there was a nurse in the room.
There was a nurse, and the nurse made you feel safe.
Did it because she had clean needles, and she walked me through it, and I felt safe and held, and it was an incredible experience. And she was doing a deep service to help people have those first. It was incredibly safe, even though I'm at this wild ass psychedelic conference in the middle of deep, Mexico.
Right.
Maybe wasn't the safest experience. That room was safe because of the space she held.
There was a nurse, yeah.
And she actually went on to work with Charlie Grob in some of the early, the first clinical trials with end of life care, and so she also knew what she was doing in holding space in those that milieu.
Yeah.
Yeah. Wendy, thank you for reminding us that healing doesn't begin with a medicine. It begins with presence. So I just want to acknowledge that your work honors the sacred work, that sacred lineage that we talked about earlier, of nurses as just the guardians in the room of safety and dignity and compassion. So thank you for that work and for helping nurses to come to the sacred work of psychedelic work and for, helping to hold space for that. Thank you for that.
Thank you. Yeah.
And for those of you listening, I so appreciate you following along on this growth journey together. You know what I'm going to say? Don't just, hit end. Don't hit pause. If you found this episode valuable, please consider sharing it, giving it 5 stars or a thumbs up, or hey, even a nice review. And thank you to those of you who have done that already. If you're the social type, you can give us a follow on Instagram at Psychedelic Divas. Thanks for listening. And just sending love and peace as we navigate these times together. So stay safe out there, people, okay? All right, thank you.